Hello everyone, I'm Mina, a clinical pharmacist. In today's video, I will conduct a pharmacological review of the medication Linaclotide. Linaclotide is a gastrointestinal agent and belongs to the pharmacologic class of guanylate cyclase C agonists. Labeled indications. Linaclotide is approved for the treatment of refractory chronic idiopathic constipation in adults, functional constipation in pediatric patients 6 to 17 years of age, irritable bowel syndrome with constipation in adults. Linaclotide may also be used off-label for the treatment of refractory opioid-induced constipation. Mechanism of action of linaclotide. After taking linaclotide, it travels from the stomach to the intestine without being absorbed into the bloodstream. In the intestine, linaclotide binds and activates specific receptors called guanylate cyclase C on the luminal surface of intestinal epithelium. Activation of these receptors increases intracellular and extracellular cyclic guanosine monophosphate concentrations, resulting in chloride and bicarbonate secretion into the intestinal lumen. Water molecules follow chloride and bicarbonates molecules, moving into the intestinal lumen, which hydrates the stool and accelerates gastrointestinal transit. Dosage forms. Linaclotide is available as an oral capsule in 3 dosages, 72, 145, and 290 microgram. Adverse reactions. Diarrhea is clinically significant and the most commonly reported adverse reaction with linaclotide. Most frequently described as mild to moderate in severity. Mechanism of diarrhea. The mechanism of this adverse reaction is dose-related and is related to the pharmacological action of the drug. As I explained in the mechanism of action section, linaclotide softens the stool and decreases intraluminal transit time, which can lead to an unwanted effect such as diarrhea. Onset of diarrhea is varied, typically occurs within the first 1 to 2 weeks of therapy. Management of this adverse reaction depends on the severity of diarrhea, which includes dose reduction, treatment interruption, discontinuation of therapy. Risk factors of adverse reactions include higher doses of linaclotide, concurrent use of linaclotide with other laxatives, especially at treatment initiation, ethnicity like Caucasian, and older age greater than or equal to 65 years. Contraindications of linaclotide. Use of linaclotide is contraindicated in pediatric patients less than 2 years of age and patients with known or suspected mechanical gastrointestinal obstruction. Administration of linaclotide in adult patients. Linaclotide is administered orally at least 30 minutes before a meal on an empty stomach. Loose stools and greater stool frequency may occur after administration with a high-fat breakfast. Swallow the capsule whole. Do not break, crush, or chew capsules or capsule contents. Linaclotide can be administered to patients with swallowing difficulties in the following ways. Administration in applesauce, administration in water, and administration via nasogastric or gastric feeding tube. For administration in applesauce, first open the capsule and sprinkle entire contents onto 1 teaspoonful of room temperature applesauce. Swallow entire contents immediately. Do not chew the capsule content. Do not store mixture for future use. For administration in water, open capsule and sprinkle entire contents into a cup of room temperature bottled water. Gently swirl for at least 20 seconds and swallow immediately. Add another cup of water to any remaining content in cup, swirl for at least 20 seconds, and swallow immediately. Do not store the water bead mixture for future use. Administration via nasogastric or gastric feeding tube, open capsule and empty entire contents into a clean container with cup of room temperature bottled water. Gently swirl for at least 20 seconds, draw up bead and water mixture with catheter syringe and apply rapid and steady pressure to dispense the bead water mixture into the tube. Add another 30 ml of water to any remaining beads and repeat process. Flush nasogastric or gastric tube with at least 10 ml of water after administration. It is not necessary to flush all the beads through tube to deliver complete dose. Due to a lack of safety data, linaclotide is not recommended during pregnancy, and alternative agents should be considered. Breastfeeding considerations. Linaclotide is not present in breast milk. The decision to breastfeed during therapy should consider the risk of infant exposure, the benefits of breastfeeding to the infant, and the benefits of treatment to the mother.
Thanks for watching. If you found this helpful, hit the like button and please subscribe to get future video lessons.